Hi there. We're going to review how to complete the COVID-19 survey in HMIS. As you know, at the beginning of April, the Rhode Island Homeless Response Team created a shelter workflow for clients that were in shelter in the state of Rhode Island. It also created a workflow for clients that were unsheltered and encountering outreach staff. Part of the workflow is to complete the COVID screening tool. In HMIS, we mimicked the screening tool that was created, and today I'm going to show you how to access it and how to complete it. The first thing is, for any HMIS user, they'll log in and they will select the client that they are completing the survey for. Once they are on the client's page, they will access the COVID survey by using the project entry. So for example, this client is entered into the Rhode Island Coalition for the Homeless Project. I will click on the entry tab and I can access the COVID-19 survey using that tab. Additionally, for ease, surveyors could use the interim tab to access the COVID-19 survey. They would simply click on the interim icon, add an interim review. When they reach this drop-down for interim review type, they will select update and they will save and continue. Once they reach this update page, they will click on the COVID-19 survey, and here's the way that the questions are presented. The first 5 questions are related to symptoms, related to cough, fever, if you have a new cough or worsening cough, related to GI, if you're nauseated or experiencing vomiting or diarrhea, if you have new or worsening shortness of breath. We have included in our survey on HMIS all of the prompts that are provided in the survey tool that is available via PDF as well. So the ideal way to complete the survey is to complete it straight into HMIS when you encounter your client. The other way that it could be completed is by non-HMIS users. They could complete the survey tool on a PDF form, and an HMIS user from your agency could enter the data into the client's record on HMIS. Once the symptom part of the survey is completed, there is one more question related to chronic health condition. This is important because chronic health condition is one of the factors that we are using to prioritize folks to get them into housing, and in some cases out of congregate shelter and into a safer hotel setting. So having these surveys completed in HMIS will assist our system in making very quick decisions as the COVID-19 response continues. After the symptomology is determined, there are prompts related to next steps. If a client answers no to all of the first questions and to chronic health conditions, then there's nothing more the surveyor needs to do but simply scroll to the end of the survey and click Save and Exit. If the surveyor has a question that's answered yes, then the surveyor would continue on with the prompts, and they would follow the prompts to link the client up with their primary care physician, or in the event the client doesn't have a primary care physician, there are steps to get them connected with the Department of Health for testing, and if needed, for quarantine or isolation housing. The last section of our survey is really important, and this is why surveyors need to complete the survey at every contact or at least once per day with their clients so that we can monitor symptoms, we can identify clients that have symptoms early to mitigate the exposure for other clients and for staff. So it is important that we are also going back into these interim assessments and completing them over and over again and updating the information as it becomes available. The last section here indicates when symptoms began, when they began isolation if they did, when did they begin quarantine, if they were hospitalized, you would enter the date of hospitalization in there, the result of their COVID-19 test result, whether it was positive or negative. If they were tested, what date they were tested, what day were they provided with the test results, and what is their current, the day that you do this survey, what is their current symptomatic disposition? Here are the options: currently symptomatic, no longer symptomatic, confirmed recovery, or deceased. There is also a date that you could put their symptomatic disposition in, and then finally an area for clinical health notes. All of these bottom questions at the bottom of the survey are important because as we're learning, folks that have had COVID-19 and have recovered are less likely to become symptomatic again. So it is important as we continue to assess the COVID-19 response for our homeless constituents to know who has recovered from COVID-19 or who is still at risk of contracting COVID-19. So at the conclusion of each survey, you would click Save and Exit. And again, it's important to use the interim tab to conduct the survey so that you can update answers and see a history of all of the surveys and the dates that they were completed in your interim review tab. If you have any further questions or would like to learn more about accessing HMIS, you can send an email to our help desk at hmis@rihomeless.org. Thank you.